And there are things at home that we can actually do that help provide some relief, shall we say. We have a list that we also want to show you. And some of these are just like, oh, that's right. You know, like it's just good advice to go over and touch upon them. So Dr. Mena, you know,
normally a
short rest period, right?
Yeah, normally that will be fine. If you're doing an activity and you suddenly have back problems, you want to rest. You don't want to, there's studies that they show that you don't want to rest before more than 48 hours or 2 days. That can be a little more detrimental. Activity modification, if you're doing certain activity and you feel that you're starting to have back problem, just change that activity, do something else. Ice and heat, that's very common if you have some back problems or any pain in general. So you can apply either or at that point. And over-the-counter pain medications such as Aleve or Advil will be fine to take the inflammation out and help the patients with the symptoms.
And I always come back to the core. And I think that's just so important. If you can both chime in on it, you know, even just core exercises that keep this strong.
Absolutely.
So important, isn't it, Doctor?
I agree. So core strengthening exercises are very important. So it's something that we want people to engage in a healthy, active lifestyle, and part of that is engaging your core, sitting up straight, and making sure that you're mindful of it. Back braces are something that a lot of patients ask about, certainly, and that's something that we generally advise against unless you have a structural problem that requires a back brace, so instability or things like this. Using the back brace actually weakens your core and will make your back problems worse in the long run unless you have a medically prescribed reason to wear that brace. So going to the store and buying one for yourself and self-prescribing it isn't going to help you necessarily.